Introduction of ankylosis. Ankylosis is the stiffness of a joint due to abnormal adhesion and rigidity of the bones of the joint, which may be the result of injury or disease. The rigidity may be complete or partial and may be due to inflammation of the tendinous or muscular structures outside the joint or of the tissues of the joint itself. Types of ankylosis. Ankylosis can be classified based on its cause and the nature of the joint fusion. First is true ankylosis, intra-articular. It involves the bones within the joint fusing together, leading to immobility. Second, false ankylosis, extra-articular. Restrict joint movement due to factors outside the joint itself, such as scarring or muscle contractions, even if the joint bones are not fused. Third, fibrous ankylosis, involved of a soft tissue, fibers, union of joint components. And lastly, bony ankylosis. It involves the formation of a new bone bridging the gap between the bones in the joint. Next is causes of ankylosis. First, injury. Trauma to a joint can lead to inflammation and subsequent fusion. Second, disease. Conditions like rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, and infections can cause joint inflammation and ankylosis. Third, surgical procedures. In some cases, surgical procedures can result in joint stiffness or fusion. And lastly, dental ankylosis. This refers to a tooth becoming affixed to the jawbone, preventing its normal movement. Next, symptoms of ankylosis. The primary symptoms of ankylosis is joint stiffness and limited movement. Other symptoms can include pain, especially with movement, difficulty with daily activities. In some cases, dental ankylosis can lead to problems with chewing, speaking, or even delayed eruptions of permanent teeth.
Management of ankylosis. First is exercise. Reduce stiffness and stop from getting worse. For example, range of motion (ROM) exercise, low impact aerobic exercise like swimming and water therapy. Next is non-steroidal anti-inflammatory drugs, NSAIDs, over-the-counter OTC NSAIDs, including ibuprofen and naproxen, ease pain and inflammation. Next, biologic disease-modifying anti-rheumatic drugs (DMARDs), medications that reduce inflammation and pain. It's a special class of medications used mainly to treat autoimmune disease like ankylosis. Biologic DMARDs are targeted therapies. They block specific parts of the immune system like certain protein or cells that drive inflammation. Corticosteroids. Corticosteroids reduce inflammation very quickly. You might need cortisone shots, an injection of corticosteroids directly into your affected joint. Next, surgery. Gap arthroplasty (GA) procedure, surgical removal of the ankylosed fusus bone or fibrous tissue. A gap is created between the joint surface to allow movement. Next is interposition arthroplasty (IA) procedure, similar removal of ankylosed tissue, placement of an interposition material like muscle, fascia, cartilage, skin graft, or synthetic materials between the joint surface.
For the clinical manifestation, first is joint stiffness. This is one of the earliest and most common symptoms. It happens due to inflammation or fibrosis around the joint. The soft tissues, which is ligaments and tendons, lose their flexibility. It was often more noticeable in the morning, which is morning stiffness, or after a long period of inactivity. The second one is loss of range of motion. The joint gradually loses its ability to move through its normal arch. In fibrous ankylosis, motion is limited by fibrotic tissue. In bony ankylosis, bones actually fuse together, causing complete immobility. The affected one is limits the function of the limb or body part involved. For the third one is deformity. The joint may appear abnormally positioned or shaped. It occurs when chronic inflammation or scarring can pull the joint into a fixed position. If bone fused in a wrong way, it can cause visible deformity. And the last one is swelling. May be visible or felt as a swell around the joint. It causes inflammatory process that can cause a fluid buildup and soft tissue swelling. It's often represented in the early or active disease phases.
Next, for nursing diagnosis, impaired physical mobility related to hip joint inflammation as evidenced by limited range of motion. Next, for the nursing intervention, number 1, assessing patient mobility status and pain score to establish a baseline data for care planning. Number 2, encourage patient to perform passive exercise such as flexion to promote joint lubrication and maintain mobility. Number 3, administering analgesic as prescribed by doctor to reduce inflammation more fast. Number 4, educate patient to maintain proper body alignment to prevent further deformity to the patient. Number 5, apply heat packs at the affected area to reduce stiffness and help relax the muscle. Number 6, educate patient to not smoking. It can decrease density of the bone that can causes osteoporosis. Number 7, promote good nutrition to the patient, to increase the bone development and strengthen the bone. Number 8, provide physiological support to the patient to ensure the patient always motivated for undergoing treatment. Number 9, document patient response to the care plan to ensure nursing goals are well achieved.